We're going to continue our discussion of Chapter 6, the chemical examination of urine. The reason these presentations are split up into different pieces is a lot of students don't have very fast broadband, and so it becomes very frustrating to download a presentation that's over 30 minutes long. So that's why these presentations are kept relatively short. We start our discussion with the actual chemical examination with specific gravity. I want you to review Table 6.1 in your textbook. Specific gravity reflects the kidney's ability to concentrate, and we talked about this quite a bit in the last chapter of the book. We want concentrated urine for accurate testing, and the best sample for us is the first morning sample. You've been sleeping all night, the urine has been collecting in the bladder, and it becomes more and more concentrated. If the specific gravity is low, this indicates a specimen that is not concentrated and may be an indication of kidney disease, although it may also be an indication that this is a random sample taken throughout the day and you've been drinking a lot of water. The term used for a specific gravity less than 1.010 is hyposthenuric. A high specific gravity can indicate either a first morning sample, or maybe there's certain drugs that are present that increases the density of the urine, or you haven't drank a lot of water. So again, dehydration can cause a high specific gravity. The term used for a specific gravity greater than 1.010 is hypersthenuric. pH measures the degree of acidity or alkalinity of the urine. So be sure and review Table 6.3 in your textbook. A normal pH varies from 4.5 to 8.0. Normal urine is usually slightly acidic, but becomes more alkaline after meals. It's really affected by what you eat. pH can affect the stability of formed elements, so if we have a slightly acidic urine, this could start destroying the formed elements that are present, cells. So as soon as you get a urine in, it should be tested, but if not, it needs to be stored appropriately. The principle of the reaction on the pad is based on a double indicator system using bromothymol blue and methyl red. When the urine hits the pad, a reaction occurs, and depending upon the pH, it will turn from a shade of orange, pH 5.0, to green, pH 7.0, to blue, which is a pH of 9.0. The terminology used for blood in the urine, there's two different ones. There's hematuria, which indicates the presence of intact red cells in the urine, and hemoglobinuria, which is free hemoglobin in the urine. And this is due to the breakdown of the red cells with the release of the hemoglobin. Even small amounts of red cells or blood present in the urine is diagnostically important. My dad started losing weight. He went into the doctor. The only unusual result on him was he had blood in his urine. He was later diagnosed with bladder cancer. The blood pad detects a hemoglobin, hemoiety, so the reagent strips, in addition to hemoglobin, also detect myoglobin, which is a substance that's released when muscle is damaged. Myoglobinuria is myoglobin in the urine, and myoglobin is a monomeric heme-containing protein involved in the transport of oxygen in the muscles. Skeletal or cardiac muscle damage will cause the release of myoglobin into the blood, causing myoglobinuria. Myoglobinuria is very uncommon, and I tell the story of one of my students that they had a urine come in the lab that had a positive protein, and they did some additional testing and determined that myoglobin was present, and they were able to diagnose this patient with a yet undiagnosed heart condition, the muscle. He was having a heart attack. If myoglobin is suspected, dilute the urine and retest with the strip. If it's positive, then perform a creatine kinase, and if that's high, you may also suspect a condition called rhabdomyolytic process. Sorry, I had a real hard time with that word. So this is an example of the different interpretations of a positive blood test. If you see, these first two are little dots on the pad, and that indicates intact red cells, non-hemolyzed blood. The remaining pads have various reactions due to the lighter the color, the less blood is present, to the darker the color, the more blood is present. The presence of blood may indicate an infection. It may indicate traumas to the urinary tract or bleeding in the kidneys. Trauma being you were sucker punched in the kidneys when you were in a fight. False positive readings of blood are most often due to contamination with menstrual blood. So if you have a woman of childbearing age, the doctor may want to find out where she is in her cycle, because if she has blood and she's on her period, then of course it's very difficult, even if you do a clean catch, to not get a urine that's contaminated with blood. The reaction on the pad is based on heme pseudoperoxidase activity. The pad has a chromogen and peroxide, and the pseudoperoxidase activity of heme will reduce the peroxide, which then oxidizes the chromogen, and that causes the color to change from yellow to green. Ascorbic acid is known to interfere with this reaction, and so you can get a false negative reaction. And this false negative is suggested by having a positive microscopic findings. You see red cells in the microscopic, but you have a negative reagent strip result, which doesn't make sense. So it's very important that if the chemical strip indicates hematuria, you expect to see red cells in the microscopic examination. And again, if you see red cells in the microscopic examination, but you have a negative reaction on the pad, maybe you're looking at the wrong urine sample, maybe you perform the chemical examination on the wrong urine sample, so this would be a cause for repeating that particular test. Leukocyte esterase. Normally, a few white blood cells may be seen in the urine, and this is equivalent to 0 to 8 per high power field, or approximately 10 WBCs per microliter. The reason being these are scavenger cells, so they're present all the time in your tissues, in your fluids. They're looking for foreign substances to engulf and destroy. White blood cells are susceptible to lysis, so you may not be seen, but will release an enzyme causing a positive reaction on the reagent strip. The principle of the reaction is based on leukocyte esterase to cleave an ester in the pad. The cleavage forms an aromatic compound, which then couples with a diazonium salt in the test pad. The end result is an azo dye and a color change from beige to violet. The reagent strip has the ability to detect 10 to 25 WBCs per microliter. And so again, if WBCs are detected on the strip, you're going to expect to see WCs during the microscopic exam. If you don't, maybe the urine was stored improperly and the white cells lysed. So again, it has to make sense. What you see under the microscope needs to compare favorably with what you see on the pad. So here's an example of the different reactions you may see on the pad, going from negative to that really, really pretty pink, which is a strong reaction. So leukocytes usually indicate infection, and the leukocyte esterase activity is due to presence of WBCs in the urine. Another substance that we detect that may indicate a urinary tract infection are nitrites. So if we have leukocytes and nitrites present, this could suggest bacteriuria, which is bacteria in the urine. Normally, urine is sterile. It doesn't have any bacteria present. Nitrate-reducing bacteria in urine can form nitrites. So the requirements for this to be present is the bacteria present must be nitrate reducers, not all of them are. There must be adequate time in the bladder to be reduced, approximately 4 hours, and you must have an adequate dietary nitrate intake. The principle is based on the diazotization reaction of nitrite with an aromatic amine in the pad. This will then form a diazonium salt, which couples with an aromatic compound in the pad to produce the azo dye. So the color of the pad will change from white to pink if bacteria is present. This is an example of the nitrite pad. Its qualitative test is either going to be negative or positive. Nitrites are formed by gram-negative bacteria converting the urinary nitrate to nitrite. It's a screening test, and if the nitrite test is positive, that indicates the need for a culture to be performed. Important, if nitrites are present, you would expect to see bacteria during the microscopic examination. So the clinical significance of nitrites is it usually indicates a urinary tract infection, a UTI, and it can either involve the bladder, which is termed cystitis, or it can be upper the renal pelvis and tubules, which is known as pyelonephritis. There's two pathways for bacteria to enter the urinary system. The most common is movement of bacteria up the urethra to the bladder, and this is very common in women. We hold it, we hold it, we hold it, and the flushing action of urine actually prevents urinary tract infections from occurring. The other pathway is movement of bacteria from the bloodstream into the kidneys and urinary tract. The bacteria involved, E. coli is the most common, and this is a fecal contaminant. And this is why little girls are taught from the time they are potty trained to always wipe from front to back. Otherwise, you could introduce fecal contaminants into the urinary tract. Proteus, Enterobacter, and Klebsiella are other species that can cause urinary tract infection. And one important thing is never ignore a urinary tract infection. I've known several individuals who did, and they became septic. The bacteria infection became so overwhelming it entered their bloodstream and they almost died. It is normal to have very small amounts of small molecular weight proteins in your urine. No large proteins. Urine protein is often the first sign of kidney disease because it should be reabsorbed always. So you should never see an excessive amount of protein in the urine. The strip is most sensitive to albumin, and the principle of the reaction on the pad is based on the protein error of indicators. When buffers in the pad hold the pH constant, certain indicator dyes release hydrogen ions due to the proteins present. So the hydrogen ions then combine with the protein that cause a color change, and the intensity of the color is proportional to the amount of protein present. Here's an example of the pad with the different color reactions that may occur, and depending upon where you work will determine if you use the 1+, 2+, 3+ system or the numbers, the 30, 100, 300 milligrams per deciliter. The presence of protein, the term is proteinuria, is an important indicator of renal disease. False negatives can occur in alkaline or dilute urine or when the primary protein is not albumin. There are many conditions that can cause excess protein to be present in the urine. What I want you to know is the name of the condition and just a brief description of what it is. Overflow proteinuria results from increased quantities of plasma proteins in the blood, readily passing through the glomerular filtration barriers into the urine. This should not happen. We always reabsorb the protein from our urine. This is the most common type of proteinuria. It's the most serious clinically, and this can progress to a nephrotic syndrome, which will then result in the renal failure. Glomerular proteinuria occurs in the primary glomerular diseases or disorders that cause glomerular damage. Postural, also known as orthostatic proteinuria, is really weird. It's excretion of protein only when the individual is in an upright orthostatic position. Tubular proteinuria occurs when normal tubular reabsorptive function is altered or impaired. This is an indication of a chronic renal disease or the beginnings of renal failure. Fanconi's syndrome is associated with inherited or acquired diseases where tubular proteinuria will occur. Postrenal proteinuria can result from an inflammatory process anywhere in the urinary tract. It could be in the renal pelvis, the ureters, the bladder, the prostate, the urethra, or external genitalia. The leakage of blood proteins into the urinary tract will then be detected in the test for protein. Contamination with vaginal secretions or seminal fluid will also increase the protein, and that's why it is normal to have a small amount of protein present in the urine, especially in women. Microalbumin is a term used for low levels of albumin, and routine test strips are unable to detect albumin in urine that is less than 1 to 2 milligrams per deciliter. Sensitive albumin tests will detect low-level albuminuria. There's a variety of test methodologies. One uses monoclonal antibodies. These are antibodies that are used as markers that react with protein and then result in some type of visible reaction. And then chemical reactions with dye binding that also result in a color reaction. This test is most often used to monitor patients with diabetes to screen for signs of early kidney damage. Unfortunately, especially with diabetes mellitus, patients who are not in control of their disease, the disease will kill them. It can cause blindness, it can cause heart damage, and it can cause kidney damage. And the most common reason for kidney transplants are due to the kidney damage or renal destruction, and they need to replace those kidneys with operational ones. You should not see glucose in normal urine. It will appear if plasma level is over the renal threshold of 160 to 180 milligrams per deciliter. Your body just gives up. It says there's just too much glucose here. It's going to spill over into the urine. The principle of the reaction on the pad is based on a double sequential enzyme reaction that is specific for glucose. Glucose oxidase in the pad oxidizes the glucose to form hydrogen peroxide and gluconic acid. The peroxidase in the pad catalyzes the formed hydrogen peroxide to oxidize the chromogen, and then this will result in a color change. Glucosuria, glucose in the urine, is caused by pre-renal conditions such as hyperglycemia, too much glucose in the blood. The glucose exceeds the reabsorption capacity of the kidneys. Or renal conditions, defective tubular absorption. But the most common condition in which glucose is seen in the urine is diabetes mellitus. Here's an example of the different color reactions you may get if glucose is present. And so again, I just want to reiterate that whether you use the 1+ system or the number system will be dependent upon where you work. The presence of glucose, which is glucosuria, indicates that the blood glucose level has exceeded the renal threshold. And again, not only is it used to monitor diabetes, but it's also used to screen for diabetes. Clinitest tablets are used to test for reducing substances. So in the past, if we had a positive glucose, we would do this test to see if there were other sugars besides glucose present. So this detects sugars except sucrose and other reducing substances such as ascorbic acid, cysteine, and some drugs. It's based on the Benedict's copper reduction test, and the reducing substances convert the cupric sulfate in the tablet to cuprous oxide. This results in a color change from blue to green to orange, depending upon the level of reducing substances present, and all the reagents necessary are contained in the tablet. Historically, we use this to screen the urine of babies because if this was positive, it indicates galactosemia, which is a rare inherited disease, which if caught early is highly treatable. This is an example of the results of Clinitest. On the bottom, we have the guide that will be used to interpret the different colors, and on the top you have the actual test. So the tablet is put in a tube, and there's a 5-drop method and a 2-drop method. And what happens is when you add the urine to this tablet, it starts bubbling, and you never hold this in your hand because it produces excessive heat. So depending upon the reducing substances, if any present, we'll get a color change, and it goes from blue all the way to orange to brown. Ketones are the breakdown products from large amounts of fatty acids, and it will break down into 3 components: acetoacetate, which is the principal form detected by reagent strip method, acetone, which rapidly dissipates, and beta-hydroxybutyrate, which is not detected by the strip test. The principle is based on the nitroprusside reaction, which in an alkaline medium, the acetoacetate reacts with the sodium nitroprusside in the pad. This will then cause a color change from beige to purple. Some strips include a glycine in the pad, which allows acetone to be detected, so you need to read the package insert to determine if all 3 of these breakdown products are detected. Any condition that causes increased fat metabolism can result in ketonemia and ketonuria. Conditions can be divided into one of 3 categories: an inability to use carbohydrates, which is diabetes mellitus, and an inadequate carbohydrate intake, starvation, diet, exercise, loss of carbohydrates, vomiting, defective renal absorption. Ketonuria is most frequently seen in patients with uncontrolled diabetes. And there's a diet that's really popular. It's the low-carb, high-protein diet, and people know, or they want to be in ketosis. And how they know they are is they buy keto sticks and they test your urine for the presence of ketones. And one of my docs said that they had a patient that had been on this diet for so long that she was going into organ failure. And so a little bit is fine if you want to do these low carbs, high protein diets, but it is not for long term because the effects of the excess ketones can be very destructive to your body. So here's an example of the different reactions that may be obtained on the ketone pad, and it goes from negative to this deep dark purple. So again, ketones are excreted when the body metabolizes fat incompletely, and the ketones then exceed the threshold of reabsorption, and they will be present in your urine. In the past, when we had a positive ketones, we would do the acid test, and the acid test is no longer routinely performed. It detects ketones, and the advantage of the tablet test is the flexibility of specimen type. This can be used on urine, serum, plasma, or whole blood. And what you do, how you do it, is you put 1 drop of a specimen. It's placed directly on top of the tablet, and after the appropriate timed interval, the tablet color is compared with a color chart provided. Purple is positive, pink, tan, or yellow is considered negative. So what's really important is that the drop is not too large to where it would go down the sides of the tablet.